Just give it a little peace sign.
Okay, here we are again, heading home after a fairly long, steady day at 66. My partner Nick, driving with two hands on the wheel and paying absolute attention. It's another quick little tutorial of something that's come up. Just going to turn this around a bit. So here we are, and what's gone on in the past, and I'm sure many people have seen this, and they're wondering what people are doing. And I've seen many firemen do this. I've seen some emerge nurses doing that. I've seen at least one ICU nurse do this. When you have a patient that needs oxygenation but is breathing somewhat on their own and taking enough respirations, and you would want to provide supplemental oxygen to them just passively, a lot of people are taking the BVM and they're holding it like this, fairly close, thinking that they're oxygenating the patient by just sort of having oxygen, a high rate of oxygen or high concentration of oxygen flow past their face, and when they passively breathe in, they're breathing in some oxygen, right? A little bit richer in oxygen than normal ambient air. It doesn't work like that. The reason is, inside here, the little blue part is a one-way valve, okay, that only opens and allows oxygenated air, richly oxygenated air, from the BVM to pass through. If you don't actively bag this, nothing's happening. You're actually creating a small little pocket of carbon dioxide above the patient's face. I have pointed that out to the odd person who is very thankful, but they didn't realize that there's an actual one-way valve in there, and that's to prevent vomit from coming back up. I know we have filters that we put on this, like I just took off, and the filter would stop that too, but in the end, that is what this little opening is for. Okay, so when you're not actively compressing the bag, this is closed and nothing's getting through. All right, and that's not to be confused with a little pop-up valve, which you can adjust to have like a release by not having too much pressure pushed into the lungs for a smaller person or a child. All right, thanks a lot. Talk to you later. Bye for now.